what is it that defines a second wave exactly, and how do we know when we've reached that point? Joining us now is the Health Director of CSIRO, Australia's National Science Agency, Dr. Rob Grenfell. Doctor, good morning to you. The numbers in Victoria are alarming, aren't they? How much worse do you expect this to get?
Well, look, that's an interesting question, Carl, because it's the increased testing, and as there's a lot more focused testing, we would expect that the numbers will increase. And I suppose in one sense, I've been sort of wrestling with what sort of analogy we're looking at here. Think of a bushfire, for instance. We start with a single front, the wind changes, and we end up with spot fires all over the place. And that appears to be what's occurring in Melbourne at the moment. So, yes, we're about 10 days behind what actually happened with this virus when it was spread. That's the problem. So we are expecting that numbers will increase because the testing's being very, very systematic across the areas of Melbourne where the hotspots are.
So we're going to see a lot more spot fires, aren't we, before we find a vaccine?
Yeah. This was actually predicted at the beginning because I noticed you sort of mentioned the idea of a second wave. We're still in the first wave, and this is because we protracted it by suppressing the curve. Now, that, of course, gave us plenty of time to get our health services ready, prepare for intensive care cases, and as you've shown today in the news broadcast, to get our temporary hospital settings ready for the increase in number of hospitalisations that will come from this pandemic. We've been very lucky in this country to date, and we've been very, very fortunate in suppressing it for this long. But it appears that we are, in fact, looking at a growth phase, and we are all hoping that we can bring this under control.
Would you even speculate on how much more we'll see in terms of those numbers and how widespread we could see it going out if it's got a 10-day jump on us?
Well, again, that's extremely hard to predict until we actually have the testing across where they are. Our case tracking capacity in this country is amazing. So, you know, there are thousands of people actually tracing all of these cases as to where, who's been in contact with what. But again, remember, we opened our or relaxed our sort of lockdown procedures around about 2+ weeks ago, and that's when this was starting to re-emerge. And that's come from the idea that we did have in Victoria just under 200 cases of unknown cause, and in New South Wales just under 300. So, as the Federal Health Minister said, there's no time for complacency here because the outbreaks could in fact actually occur either here or even in New South Wales.
And how likely is it that we will see some of those outbreaks in New South Wales? Because the borders are still open until midnight tonight. We've even seen today people are flying in, they're coming in via train or they're driving in. Some are asymptomatic. How likely is it?
Look, I guess in one sense, the alarming thing has been that when we went into lockdown, there were just under 300 cases in New South Wales of unknown cause or unknown source. And so it's still an issue of actually some of those re-emerging through there. We're seeing some of what we call canaries in a coal mine, such as nursing home or school outbreaks. So the virus is still circulating. It's a very hardy virus, and that's the problem, we may well be descending back into some more protracted periods of lockdown, which is unfortunate. But again, we need to do this to actually save lives.
So in relation to schools, I know that they'll be heading back soon in Victoria. I mean, the idea of face-to-face schooling, I mean, in-person teaching, is that something that you would recommend at this point, or is it okay?
The challenge that the Chief Medical Officer will face is what line they actually take with regards to the schools. I know a lot of parents will obviously be very concerned about whether or not their children go to school and whether we actually move back into that situation where some kids go to school and some kids stay at home. That will be the call for the Chief Medical Officer to determine on what risks they see as the kids go back after the school holidays.
Rob, do you just feel that there's been a change in the community, that there's that sense of angst has come back again?
Oh, most definitely. The sense of angst has come back again. And I think for everybody who's in suburbs that are actually in lockdown, and also, our fellow citizens that are in the towers at the moment that are in extreme lockdown, I think the anxiety's increased. And for the rest of us, I think in one sense, certainly in Victoria, the idea that now venturing out of the home is actually risky again. I would certainly urge others, particularly New South Wales, to actually take a lesson from what's been occurring here and think, yes, this could happen here. And let's hope that we can suppress it from our other states that have managed to virtually eliminate the virus.
Really, really quickly, because we are pushed for time. Sorry to do this to you, but how far, is there any news on a vaccine, further developments?
Look, the vaccine work is extremely exciting as to where we've stepped to. So we're seeing now candidates like one of those, the Oxford candidates, moved into phase 2-3 trials, which are actually towards the end of the human trials. They've started those in Brazil and South Africa. That's really exciting. But again, you see, there's still it has to pass that test before it's actually deemed to be a success. And then after that, it has to be manufactured to the billions of doses that we'll need worldwide and then distributed. So, you know, that's still a tortuous path, but still very optimistic about the performance of a number of those vaccine candidates in the mid to late stages. And maybe in the new year, we'll actually be seeing a vaccine starting to be disseminated. But again, I've still got cautious optimism there.
Okay,
but optimism, though.
No matter how
holding on to
cautious.
that.
Thank you, Doctor. Well, just